A little bit about post-traumatic stress disorder by Dr. Michelle Stevens. Post-traumatic stress disorder, or PTSD, is a complex psychiatric condition that develops in some people after they've experienced or witnessed a severe traumatic event. PTSD can affect a person physically, emotionally, mentally, socially, and even spiritually. People who suffer from PTSD often feel great distress when their symptoms occur. For this reason, those with the disorder often make attempts to avoid anything that will trigger their symptoms, including the avoidance of certain people, places, thoughts, feelings, and memories. People who develop PTSD have usually experienced the situation in which they feared they would die in a violent way, such as from an assault, natural disaster, or accident. Someone who witnesses another person being hurt in such a way can also develop PTSD. There's a big difference between the normal life stressors that cause normal psychological trauma and the unique stressors that cause post-traumatic stress disorder. In everyday life, there are many events that can make us feel traumatized, like divorce, the loss of a job, or a miscarriage. While these events are traumatic, they are not the types of situations that cause PTSD. The types of stressors that can lead to PTSD are events that make a person panic and fear for survival, such as combat, assault, natural disasters, and horrific accidents. About 60% of men and 50% of women will experience at least one severe traumatic event in their lifetime. However, the vast majority of these people will not develop post-traumatic stress disorder. Only 7 to 8% of the population suffers from PTSD at some point in their lives. Because post-traumatic stress disorder affects people in multiple ways, it often requires multiple types of treatment. Physical symptoms are often best treated with medication, but medication alone cannot address all the symptoms of PTSD. At their core, severe traumatic events cause us to question the world and our place in it. In order to resolve these existential questions, it's usually best to seek out some form of talk therapy. With proper support and guidance, it is possible to overcome the symptoms of PTSD and go on to lead a fulfilling life.